Hello, boys and girls. Today's word is healthcare. Everybody's talking about healthcare. Government takeover of healthcare. What's going to happen? Government takeover of healthcare is not necessarily, the government can't provide good healthcare. Well, we haven't got good healthcare anyway. Oh, I know that people are talking about Canada and the OHIP program. I don't think they're identifying it as the OHIP, but that's what it's called. I've been to Canada. I've studied OHIP. They weren't happy with it back in the early 90s, maybe even the late 80s. And but the insurance industry is worried about their little apple cart being upset, and they should be. Insurance is the third party in the equation, and actually they're the unnecessary party in the equation of healthcare. We need doctors, we need patients, we don't need third parties telling everybody else what to do. And they've been doing that for a long time. Those of you who know me well know that I ran a healthcare network in the 90s, and I got out of that business in 99. Couldn't afford it anymore. I was an honest healthcare provider, and that was like suicide. The government, I did a lot of government healthcare, Part A Medicare certified, CORF certified centers, Part A certified centers, and we had fiscal intermediaries. They aren't really the government, but they are really the government because they wear the uniform of the government and the label, and they have the power of the government. Which means, of course, they can be dishonest and get away with it, and you can't be dishonest and fight back. You can't fight dirty like they fight dirty. I lost so much money I turned it over to another company on 9/10/99. They opened up in my facilities. Anyway, 80% of the healthcare cost is in administration, and I used to focus on the administrative costs most of all because I didn't want to control the cost of care provided to the patient, since that was less than half the cost and should have been the majority of the cost. That's where we needed to kind of not focus. Let physical therapists, most of my centers were physical therapy centers, let the physicians and the other professionals do what they've been trained to do. And if I could buy supplies cheaper, buy them cheaper. That was where I focused. Paper clips or paper clips. And that is a good place to focus. The bureaucracy and the paperwork required by the insurance industry is a majority of the cost and what drives healthcare out of control. If you don't get paid for treating one patient because they've pulled some kind of a shenanigan on you, then you've still got to pay for your equipment and your costs and everything else like that, your employees, your building. Each one of my centers costs $10,000 a month if not a patient came in. So 10 of them here in Florida and 2 of them in New Jersey. Quite expensive. I'm a lot less stressed out these days sitting here and doing what I do with the stock market and what have you. Anyway, and I bought health insurance for about 75 people. They had Cigna, which Connecticut General, which was, in my belief, the best in health insurance available in those days. Today, my life and my health are both insured by God. To my knowledge, the only person who can insure my health and my life is God. No one else can. And I am still involved in healthcare, mostly in alternative medicine these days, and med spas and things like that. Look good, feel good, stay healthy. Because if you don't, there's no other hope, no other place to turn. Physicians, in the early 90s, I tried to organize physicians, and I tried to get them to work with each other, and they were very suspicious of each other. They wouldn't work with each other. They should have been more suspicious of the insurance industry and the third party, because the third party came in and controlled everything. I saw what happened to the drugstores 30 years ago, and I saw the same thing starting to happen, and still continuing to happen, to the physicians. Eventually they'll all be employees working for the big conglomerate health organizations that'll be formed in the somewhat near future. Not that that's a bad thing, But pharmacists all work for Walgreens, and it used to be Jack Eckerd. Jack Eckerd was one of the first people to go around and organize the pharmaceutical industry. But more recently, it's Walgreens, and of course they don't make any money at all. That's why there's a Walgreens on every street corner, almost like the gas stations of the 50s and the 60s. Not that those guys are doing us any favor anyway, and we can get into the alternative energy kind of projects on another day. But the other thing I'm hearing is, oh yes, and look over my shoulder, you can see that I still have some healthcare equipment. That's an electric stem machine, about a $4,000 machine. I use it these days on my abs, so I can lay there and watch the stock market and do my exercises without really having to work. Anyhow, the other thing I'm hearing more recently is Ben Bernanke. Everybody's criticizing Ben Bernanke. Everybody's saying that he's wrong, or a lot of people are. CNBC, some of the experts. There are no experts qualified to second guess Ben Bernanke. He is the most educated and the most studied person in our country on the only model that we have for what we're going through, which is the Great Depression. I predicted this in the year 2000. You can remember what happened in 2000. That we were heading for something like this, and it was basically because of one thing that happened back then, and everything he had been associated with was left in financial ruin when he left before. But Ben Bernanke, let's hope he's right. I'm certainly not qualified to second guess him, and I don't think anybody else is either. He's probably one of the smartest people in our society. And that's the other side of the coin. Doctors of any profession, whether it be healthcare, whether it be economics, are the most educated and hopefully the smartest people in our society. And who deserves to make the most money? The smartest and most educated people. At least that's what I believe. I may be smart, but I'm not that well educated. Anyway, let's hope that these people are right and they can lead us out of the woods. Government healthcare may be the lesser of two evils. So, happy trading. I'm trying to fill my private agendas. I'm sure everybody else is too. I'm trying to make money in this nightmare. But happy trading. And now, back to you.